Drug therapy of chronic stable angina and acute coronary syndrome. Drug classification. Antiplatelet agents. Example aspirin. Mechanism of action is it inhibits cyclooxygenase, which in turn produce the thromboxane A2, a potent platelet activator. It should be administered as soon as acute coronary syndrome is suspected. Next classification, adenosine diphosphate receptors antagonist. Example clopidogrel. It inhibits platelet aggregation. Alternative for patients who cannot use aspirin. Next classification include nitrates. Nitrates include sublingual nitroglycerin, translingual spray nitroglycerin, nitroglycerin ointments, transdermal nitroglycerin, extended release buccal tablets, isosorbitrate dinitrates, IV nitroglycerin. Once again, repeat. Sublingual nitroglycerin, translingual spray nitroglycerin, nitroglycerin ointments, transdermal nitroglycerin, extended release buccal tablets, isosorbit dinitrate, IV nitroglycerin. Mechanism of actions, it promote peripheral vasodilation, decreasing preload and afterload coronary artery vasodilation. Classification. Beta adrenergic blockers. Beta adrenergic blockers include atenolol, carvedilol, metoprolol, propranolol. Once again repeat. Atenolol, carvedilol, metoprolol, propranolol. A small load. Mechanism of action. Inhibits systemic nervous stimulation of the heart to reduce both heart rate and contractility, and also decrease afterload. Next classification, calcium channel blockers. It include amlodipine, diltiazem, nifedipine, nicardipine, verapamil. Once again, amlodipine, diltiazem, felodipine, nifedipine, nicardipine, verapamil. Mechanism of action of calcium channel blockers are prevent calcium entry into vascular smooth muscle cell and myocytes. Coronary and peripheral vasodilation, reduce both heart rate and contractility. Next classification, angiotensin converting enzyme inhibitors. Example, ACE inhibitors. Examples are captopril, enalapril. Once again, captopril and enalapril. Mechanism of action, prevent conversion of angiotensin first to angiotensin second, decreased endothelial dysfunction, useful with heart failure, tachycardia, myocardial infarction, hypertension, DM and chronic kidney disease. Unfractionated heparin. Heparin, it prevents conversion of fibrinogen to fibrin and prothrombin to thrombin. Once again repeat. Unfractionated heparins. Example, heparin. Low molecular weight heparin in deltaparin, enoxaparin. Mechanism of action, bind to antithrombin 3, enhancing its effects. Heparin antithrombin 3 complex inactivates activated factor 10 and thrombin. Prevent conversion of fibrinogen to fibrin. Glycoprotein 2b, abscimab. Examples are abscimab, triophylben, eptifabatide. Mechanism of action: prevent the binding of fibrinogen to platelets, thereby blocking platelet aggregation. Standard antiplatelet therapy in combination with aspirin for patients at high risk for unstable angina. Next classification include opioid analgesis, that is, example is morphine. Function as an analgesic and sedative. Act as a vasodilator to reduce preload and myocardial O2 consumption. Fibrinolytic therapy. Example, recombinant plasmogen activator RPM, and also tissue plasmogen activator TPA, TNG TPA. Mechanism of action: it breaks up fibrin meshwork in clots, used only to ST segment elevation during myocardial infarction.